Dear all that are listening in, you're very welcome to our discussion today. But before we go into our discussion, allow me to thank the Uganda Union Women's Ministries Department for organizing these very enriching evangelical meetings. It's my hope and prayer that you are richly blessed as you listen in. My name is Jonathan Mayito. I'm a physician at the Infectious Diseases Institute at Mulago Hospital. I was asked to talk about hypertension, otherwise commonly known as high blood pressure. As we go into this discussion, I'll lay out for you the different stages that one goes through as they become hypertensive. The normal blood pressure should be less than 140 over 90. And majority of the people usually average at 120 over 80. We have the prehypertensive stage, where your blood pressure falls between 130 to 140 over 80 to 90. At this stage, you're not considered hypertensive, but you're considered to be at a very high risk of becoming hypertensive. And usually, we will institute all possible interventions at this stage to prevent you from becoming hypertensive or to delay your becoming hypertensive. The next stage is what we call stage 1, and this is when your blood pressure falls between 140 to 160 over 90 to 100. This stage is true hypertension. The second stage is what we call stage 2, and this is when your blood pressure is higher than 160 over 100. And at this stage, we think that you're at a very good risk of suffering heart-related problems, like stroke, like heart attacks, like destruction of your blood vessels, and others, as you're going to see below. There are two types of hypertension. There's a primary and the secondary hypertension. Primary hypertension constitutes more than 95% of the hypertension that we see, and the secondary constitutes only 5% of the hypertension that we see. Primary hypertension is that hypertension where there is no clear underlying cause of the high blood pressure. And this is the kind of hypertension that is related to age. As we advance in age, then our blood pressures go up. And in some people, the blood pressure goes higher than expected. In men, this usually happens starting at the age of 55 years. And for women, starting at the age of 65 years. But this situation has changed. We see hypertension at much young ages, starting in the 40s, and some unfortunate few starting in their 30s. The main problem here is one has the genetic predisposition or the genetic risk to become hypertensive. And if the genes are given the right environment to manifest, then one becomes hypertensive. And the right environment, I'm talking about things like overweight, obesity, a salt-based diet, cigarette smoking, alcohol intake, and use of certain medication. And this medication can be the conventional medication that we use to treat different ailments. Just to mention a few, some nasal drops contain drugs that can raise someone's blood pressure if used over a long period of time. We have the steroids. The common one that people are aware of is Dexa, in full that we call dexamethasone in full. It's a drug that is commonly used to treat allergies like skin allergies, respiratory tract allergies, and it gives quick relief. Therefore, it tempts people to always pick it up and use it when they have symptoms. And you find that people tend to use it for a very long time. But the steroids like dexamethasone have several side effects which are not good for the body, and one of them is hypertension. The other drugs that can cause hypertension are the illicit drugs, the illegal drugs like cocaine. They've also been associated with development of hypertension. Even some herbal medication, they've been associated to development of high blood pressure. I would like to emphasize the salt diet. Africans, we are known to have what we call salt-sensitive high blood pressure or hypertension. What does this mean? That for even a small amount of salt that we take, our blood pressures are prone to rise higher than for the white who take the same amount of salt. And this is within our genes. So if we are to be careful about anything, it is salt. This has been proved in research, and there's no doubt about it. The biggest challenge with salt is that raw salt that you normally add to your eggs, to your avocado, to your salad to make it tasty. If you are to do this over and over, then it can cause you problems if you're genetically predisposed. The other form of hypertension, as I mentioned, is secondary hypertension. And this is the type of hypertension where there is an underlying cause. And this is the type of hypertension that usually happens at a young age. So if we see someone before their 20s, or in their 20s, or in their 30s developing hypertension, then we investigate deeply to try and find a cause, because there's usually a cause. And the causes are usually, as I'm going to mention below. Commonly, the causes are related to problems in our arteries. And our arteries are the vessels that move blood from the heart to the rest of the body. The common arteries that are affected, one is the big blood vessel that moves blood from the heart to supply the rest of the body. We call this the aorta. In some people, it can be narrower than expected, and this causes high blood pressure in the parts that are supplied by the arteries. The other artery that is commonly affected is what we call the kidney or renal artery, and this is the blood vessel that supplies blood to the kidney. The kidney is at the center of the body's mechanism of controlling body pressure. So if the artery is narrow, the kidney will sense that there's low flow of blood to it, and it will set into mechanism to try and raise the blood pressure, and this will push your blood pressure higher than what is expected. The other common problem are other kidney diseases. Your kidney might be filled with cystic masses that take away the normal tissue that is supposed to carry out the kidney functions, and this can raise your blood pressure. And other diseases that cause inflammation within the kidney can also reduce the functioning of the kidneys and lead to high blood pressure. When you talk about kidney disease and high blood pressure, sometimes it is the chicken and the egg. You don't know what comes first, because kidney disease can lead to high blood pressure, but then also high blood pressure can bring about kidney disease. So the kidney is one area that is a common source for the secondary hypertension. The other cause of secondary hypertension is pregnancy, and this is for the ladies. There are three ways that pregnancy can contribute to one's development of high blood pressure or having blood pressure that is difficult to control. One, the lady, before they get pregnant, might be with normal blood pressure. When they get pregnant, the pressure raises. To some, when they've delivered, they can return back to normal. But the second group of women, that will be the beginning of them having high blood pressure. So it means that they've been with normal blood pressure, they get pregnant, the blood pressure raises, they become hypertensive, they deliver, and the blood pressure refuses to go back to normal, and they start their hypertensive journey. The third category of women are those women that are hypertensive before they get pregnant. When they become pregnant, their blood pressure becomes difficult to control. It gets out of hand. And even when they deliver, they remain hypertensive. High blood pressure in pregnancy can be very dangerous. The women can become unconscious, and in some instances, they even get seizures. And death is not usually very far from such complications of high blood pressure in pregnancy. The other common cause of secondary hypertension are thyroid diseases. Thyroid can dysfunction in two ways. It can work higher than normal, it can work below normal, and in both instances, one will usually manifest with high blood pressure. Another common cause is overproduction of a hormone that causes retention of salt in our bodies. This hormone is from a small gland that is just above the kidneys, that is called the Adrenal Gland. So it produces this hormone, and the hormone goes to the kidney and causes the kidney to retain a lot of salt in our body. And as I've already mentioned, the salt causes the blood pressure to raise. Another common cause is a tumor, a form of cancer that produces hormones that can raise your blood pressure. And this kind of hypertension is well characterized, and a good health worker can pick it out and investigate for it. Having talked about the types of hypertension, the listeners, I'm sure, are eager to know, how does hypertension present? As we talk about the presentation of hypertension, I want to mention that we regard hypertension as a silent danger. If you want, call it a silent killer. And why is this so? This is because, unlike other diseases like, say, malaria, when you have malaria, your body will tell you that you have malaria. You get fever, you get body aches, and all those signs and symptoms. However, for high blood pressure, usually there's no clear warning sign that your pressure has gone up. And one may stay for years in this state, but the blood pressure is having its effect on the body. And the first warning sign that you may get may be one of those severe signs, such as stroke, such as sight problems, such as heart failure, such as vascular problems. So hypertension is a silent danger. You may see someone walking here and carrying on their normal activities, but when you check their blood pressure, it is very, very, very high, and it's just minutes away from danger. Otherwise, the mild symptoms that one might get when their blood pressure is high, they're very common signs. Maybe a mild headache, maybe some fatigue, but you usually brush it off and continue your usual activity. So the only way to know if you have hypertension or your blood pressure is high is to have it checked it out. You have it checked it out by a competent health worker. Usually when you go for a blood pressure checkup, the health worker will allow you to rest for a few minutes, at least 5 minutes, to allow your body mechanisms to return to normal, because activity like walking, like running, doing our usual work can push the blood pressure a little high. But in someone that is not hypertensive, when they rest for a few minutes, the blood pressure returns to normal. So other than allowing you to rest, if your blood pressure is being taken for the first time, the health worker will measure the blood pressure in both arms, the right and the left, and then also the leg. And by doing this, if the health worker finds big differences in blood pressure taken in either arm or the leg, then that can be a pointer to some vascular problems that we've already talked about. And then we can do more investigations to determine the real problem. Other than measuring your blood pressure, the health worker will examine your body to look for, one, clues for what could be the underlying cause for the high blood pressure, but two, to also pick out the complications that have already happened for you having had a raised blood pressure for a period of time. So the examination will include the eyes. As I've already mentioned, the eyes are commonly affected. The heart, as I've already mentioned, the heart is commonly affected. Then the blood vessels, as I've already mentioned, the blood vessels are commonly affected. So after the examination, then the health worker might request for some investigations. And the investigations serve to the two purposes. One, to try and determine the cause of the high blood pressure, and 2, to pick out the complications. The common investigations will include the kidney function. We've already extensively talked about the kidney and high blood pressure. The second investigation will include the eye examination to pick out those complications. The eye is one of the organs in the body that is very sensitive to raised high blood pressure. And in some instances, it may be the only signs that one has that has had hypertension for a period of time. The other exam will be the heart exam. And for the heart exam, the heart investigations, we normally carry out 2 investigations. One is called the ECG, and this looks at the way the electrical transmission, it looks at the electrical transmission through the heart muscles. For the heart to contract well, messages have to go through the heart muscle, and then all the muscles contract at a go, and they can push out blood, or they relax at a go so that they can allow in blood. So the ECG can detect any abnormalities along that path. The other investigation we normally do is the echo. The echo looks at the structures of the heart, the muscles, the thickness of the muscles, the walls within the chambers of the heart, the valves that allow in and allow out blood. So it can detect any abnormalities along that. Or the blood, the big blood vessels that leave the heart to supply the rest of the body, or that come back to the heart to bring back blood to the heart. So those 2 investigations are very important. And depending on the complications that the health work suspects, other investigations can be done. For instance, if they suspected heart attack, then the ECG can be very informative, but then there's also some blood investigations that can be done. So more investigations can be done beyond the ECG and the echo. The other investigation is an abdominal ultrasound. The abdominal ultrasound will tell us about the size of the kidneys, about the texture of the kidney tissue, and all that can be very informative as to tell us about the complications of hypertension or the potential causes of hypertension. And then the ultrasound can also tell us about the adrenal gland. I've already mentioned that the adrenal gland can produce a hormone that controls salt retention in the body. So it can tell us if there's a lot of tissue in that gland that is causing it to produce a lot of that hormone, or there's actually a mass or a tumor that is producing a lot of that hormone, and we do the necessary intervention. The other common investigation will be the thyroid function. How is your thyroid function? Is it functioning at a higher rate or at a low rate? And then we can make the necessary intervention. So those are some of the common investigations, but the list can vary according to what the health work will have picked from interacting with you or from examining you, and can request for other tests. After the investigation, then the health worker has to decide on how you're going to be managed. And I want to state that management of high blood pressure is not about medication. No, it goes far beyond medication. And it can take about 4 modalities. The first one, and very important, is education. The health worker has to educate you about the disease. Why did the disease come? What were the risk factors? And what damage do we have? And how we are going to manage this. If the health work educates you and you clearly understand the genesis of the problem and where it stands and what can be done about it, then you're likely to be more compliant with the treatment, the different treatment modalities that is going to suggest. And then two, you'll be able to pick out any early danger signs that can trigger you to go to the health worker to seek help before it is too late. The second thing is about lifestyle change. Lifestyle, as I've already mentioned, some of the things like overweight, obesity, then nutrition regarding salt, are a big contributor to your hypertension. And therefore, to control the pressure very well, we have to target those aspects. And it can be a full lecture about the lifestyle changes, the nutrition, the exercise. But briefly, the equation has to balance. The calories that you take in, the energy that you take in, has to balance with the energy that you put out. When you eat food, food is converted into energy. The body will use just the energy it needs, and any excess of the energy it will store. It will store in the body. And once the body starts storing, that's where the problems begin from. So you have to do extra work to burn off that excess calorie so that it's not stored by the body. And that's how we talk about exercises. And there are different forms of exercises that we can talk about, but maybe at another time. So lifestyle education, lifestyle changes are very key, before I even mention about medication. So after we've addressed those two, then we can talk about medication. Depending on what the health worker has found from examining you and the investigations, then he will put together some form of medication to try and address the problems that he has found. For hypertension per se, usually this is chronic treatment. I mean, treatment that you are going to take over a long period of time, if not for your lifetime. There are a few instances where we can stop the medication for hypertension. Okay, but as I mentioned, there are a few, especially for the primary hypertension. For the secondary hypertension, if we've addressed the problem early enough, then some of that hypertension can actually be cured and someone gets off medication. But if the secondary cause has also been there for quite some period of time, even if it is removed, the body has already adjusted and changed to accommodate the high blood pressure, and therefore you might need medication even if the problem is removed. For the primary hypertension, as I mentioned, there's no particular cause, but the pressure goes up. And the treatment is really geared towards controlling the high blood pressure. And therefore, it's likely that you'll be on this medication for long, if not for a lifetime. And if consideration is to be made to stop the medication, this has to be supervised by a health worker. Because if you suddenly stop the medication, that can be dangerous. Because if there are any surges, they can cause complications, because your blood vessels have been used to the controlled hypertension, and now with a surge, they may just break and give you a stroke or give you a heart attack. So this has to be supervised by the health worker. The third thing is, the fourth thing is adhering to the medication as prescribed. Because any alteration in the way you take the medication might mean that your blood pressure is not well controlled, and therefore you continue to have the damage from the raised blood pressure. And two, as I've already mentioned, if you suddenly stop, you can suffer complication such as stroke and the like, as I've mentioned. Then the last one is you have to stick to the schedule for your checkups. Initially, the checkups will be frequent, maybe every 2 weeks. But as you stabilize and your pressure is under control, the schedules will be longer, maybe monthly, maybe every 3 months, or even once every 6 months, depending on the complications that they are. And for the investigations that we've talked about before, you should aim to have them done at least once every 2 years, so that if there are any changes, they are picked early and they are addressed. Allow me to end here, and thank you for listening in. At another opportunity, we can expand on what we've talked about. Thank you very much.